6 months after President Trump embraced our wonderful new healthcare bill, and a month after it was last left for dead, Republicans are down to just 18 days to repeal and replace Obamacare. While Trumpcare has re-emerged in an undead state before, zombies don't move that fast, and the fiscal 2017 budget resolution allowing the GOP to do an end run around a Democratic filibuster is set to expire at midnight on September 30. Trump, with his focus turned to tax cuts, appears to lack enthusiasm for one last massive push. Over the weekend, he tweeted, "Republicans, sorry, but I've been hearing about repeal and replace for 7 years, didn't happen." He added, "Republicans must start the tax reform/tax cut legislation ASAP. Don't wait until the end of September. Needed now more than ever. Hurry." While the final whistle hasn't blown, it seems pretty clear that two big winners have emerged from the Republicans' defeat: Bernie Sanders and his vision of Medicare for all, and, if stock prices are an accurate gauge, the health insurance industry. IBD's medical managed care industry group is one of the best performing sectors since Election Day, rising 40% compared with a 17% gain for the S&P 500 index. Centene, CNC, the biggest remaining player on the Obamacare exchanges and a major participant in the Medicaid expansion, is currently ranked number 1 in the managed care group by IBD based on stock performance, earnings, revenue, and profit margin trends. Centene announced a $3.75 billion deal to buy Fidelis Care, expanding its reach into New York. The four companies that had their mergers blown apart early in 2017, Anthem, ANTM, Cigna, Aetna, AET, and Humana, HUM, all are up in excess of 40%. United Health Group, UNH, the biggest of the bunch and a component of the Dow Jones Industrial Average, is up 38%, versus 21% for the overall average. On Tuesday, managed care stocks lagged the major indexes, led lower by Anthem, which signaled it may pull out of more Obamacare exchange markets in 2018. Insurers have until September 27 to finalize their plans. IBD's stake: most managed care stocks are too extended to chase, meaning they're at least 5% beyond a buy point, the optimal point for acquiring shares to maximize chances for a near-term gain. Here's a good place to start to find stocks that may be setting up for advances. The group of stocks that fit IBD's investing criteria on the IBD leaderboard have outperformed the S&P 500 by 60% this year. What is interesting is that the gains come even as support for single-payer is on the rise and Sanders rails that the healthcare system is failing because it is largely designed not to provide quality care in a cost-effective way, but to make maximum profits for health insurance companies, as well as drug and medical equipment companies. Managed care investors aren't yet worried about single-payer because it probably can't happen before 2021, may not happen at all because its financing will be controversial, and even if it does, it still doesn't rule out a big role for private insurers. After all, many states have turned their Medicaid programs over to managed care companies, and Medicare Advantage is one of the reasons profits are surging for Humana and others. On Wednesday, Sanders is expected to unveil his Medicare for All legislation, and he's no longer a voice in the wilderness. 4 potential 2020 contenders for the Democratic presidential nomination have signed on as co-sponsors, including Senators Elizabeth Warren of Massachusetts, Kamala Harris of California, Cory Booker of New Jersey and New York's Kristen Gillibrand. Even relatively conservative West Virginia Democratic Senator Joe Manchin said Tuesday that single-payer is worthy of consideration. The lack of popularity for the Affordable Care Act and the horrific polling for the GOP Trump care plans have left an opening for Sanders, whose big unveiling may even overshadow the expected release of new repeal and replace legislation from GOP Senators Lindsey Graham and Bill Cassidy. Senate Finance Committee Chairman Orrin Hatch, Republican Utah, and GOP Senator Rand Paul of Kentucky both threw cold water on prospects for the new bill on Monday. Paul, whose state of Kentucky stands to be among the bigger losers under the Gran-Cassidy plan, said that the bill would probably be worse than doing nothing. Even as some Republicans push for one more attempt at killing Obamacare, others in the GOP are negotiating with Democrats on a plan to shore up the exchanges to avoid a premium spike in 2018. Related Obamacare fines nailed the working class in 2017 and other unpopular truths.